हेलो एवरीवन, न्यू चैप्टर एंडोक्राइनोलॉजी पेपर 2 शुरू कर रहे हैं। इसका फर्स्ट क्वेश्चन है मैक्सिमम प्रोडक्शन ऑफ HCG occurs during A first trimester, B second trimester, C third trimester and D in plantation. The right option is A first trimester. Next question is how many parts are there in insulin receptor? A2, B1, C3, D4. Right option is D4. Next question is in Addison's disease the following is seen: A hyperkalemia, B hypernatremia, C hyperglycemia, D high blood pressure. Right option is A hyperkalemia. Next question is anabolic action on protein is mediated by A ACTH, B insulin, C testosterone and D TSH. Right option is B insulin. Next question is normal body temperature can be raised by A androgen, B gonadotropins, C estrogen and D progesterone. Right option is D progesterone. Next question is milk injection reflex is mediated by the hormone A oxytocin, B vasopressin, C growth hormone and D thyroxine. Right option is A oxytocin. Next question is a patient with hypothyroidism is likely to have A subnormal mouth temperature, B increased body hair, C moist hand and feet and D none. Right option is A subnormal mouth temperature. Next question is regarding myxedema the following are true except A swollen edematous look of the face, B impotency and amenorrhea, C BMR increased by 30 to 45% and D dullness, loss of memory. Right option is C BMR increased by 30 to 45%. Next question is insulin stress test assay estimates A diabetes mellitus, B growth hormone, C glucagon assay and D catecholamines. The right option is B growth hormone. Next question is neurotransmitter which controls secretion of prolactin. A serotonin, B GABA, C somatostatin, D dopamine. The right option is D dopamine. Next question is excess aldosterone is associated with all except A water retention, B hypokalemia, C hyperkalemia and D hypertension. Right option is C hyperkalemia. Next question is adrenal insufficiency causes A rise in plasma sodium / potassium, B low blood pressure, C increased breakdown of protein and D all of the above. Right option is B low blood pressure. Next question is what is not true for aldosterone? A secreted in increased amount when blood volume falls, D is a polypeptide, C secretion tend to increase renal arterial pressure and D secretion result in reduction in urinary volume. Right option is B is a polypeptide. Next question is insulin facilitates glucose uptake in A kidney tubules, B red blood cells, C brain and D skeletal muscle. Right option is D skeletal muscle. Insulin facilitates glucose uptake in skeletal muscle. In Cushing syndrome the following features are found except A rapidly increase adiposity, B polycythemia, C hypertension, D impotence of atrophy of testes. Right option is C hypertension. Next question is transaction of pituitary stalk lead to increase in A TSH, B prolactin, C growth hormone and B ACTH. Right option is B prolactin. Next question is Cushing syndrome is characterized by A eosinophilia, B hyperkalemia, C nitrogen retention, D poor wound healing. Right option is D poor wound healing. Next question is site of ADH action is A proximal tubule, B loop of Henle, C vasa recta, D collecting tubule. Right option is D collecting tubule. Next question is increase in insulin receptor is seen in A starvation, B obesity, C acromegaly and D diabetes. Right option is A starvation. Next question is cortisol A secretes increase following injury, B. Favor protein synthesis. C. Enhance effect of antigen antibodies reaction. C. Tend to lower body pressure. Right option is A. Cortisol secretes increase following injury. Next question is testes does not produce A. Estradiol, B. Testosterone, C. Fructose, and D. Inhibin. Right option is B. Testosterone. Next question is, if a lady present with very regular 27-day menstruation cycle, ovulation should occur on day A12, B13, C15, and D14. Right option is B14. Next question is, level of which hormone is increased in post-menstrual woman? A. Estrogen, B. FSH, C. Cortisone, D. progesterone. Right option is B. FSH. Next question is, prostaglandin secretion is maximum in A. urine, B. semen, C. amniotic fluid, and D. saliva. Right option is B. semen. Next question is, FSH is secreted by A. chromophore, B. theca internal cells, B. basophil, and D. acidophil. Right option is C. basophil. Next question is, function of luteinizing hormone is A. follicle maturation and ovulation, B. milk secretion, C. causes progesterone secretes during ovulation, and D. maintains placenta. Right option is A. follicle maturation and ovulation. Right option. Next question is, the role of human placenta lactogen is A. stimulate milk production, B. fetal breast development, C. growth of fetus, and D. endocrine regulation. Right option is C. growth of fetus. Next question is, somatostatin is produced by which cell of pancreas? A. alpha, B. beta, C. delta, and D. acinar. Right option is C. delta. Next question is, which is false regarding insulin? A. secreted by beta cell, B. glycopeptide, C. causes lipogenesis, and D. promote glycogenesis. Right option is B. glycopeptide. Next question is, cycle AMP serves as a second messenger in secretion of all except A. FSH, B. glucagon, C. epinephrine, and D. estrogen. Right option is D. estrogen. Next question is, thyroxine binding globulin is increased in A. pregnancy, B. nephrotic syndrome, C. glucocorticoid treatment, D. cancer chemotherapy. Right option is A. pregnancy. Next question is, insulin causes all the following reaction except gluconeogenesis, B. glucogenesis, C. triglyceride synthesis, D. increase utilization of glucose. Right option is A. gluconeogenesis. Next question is, somatostatin inhibits secretion of all except A. growth hormone, B. epinephrine, C. insulin, and D. TSH. Right option is B. epinephrine. Next question is, estrogen action at the target cell requires A. membrane receptor, B. mitochondrial receptor, C. microsomal receptor, and D. nuclear receptor. Right option is B. nuclear receptor. Next question is, which is true about growth hormone? A. act on nucleus, B. structure similar to HCG, C. it's a peptide hormone, and D. originate from ACTH precursor. Right option is C. it's a peptide hormone. Next question is, Sertoli cell secretes A. serotonin, B. inhibin, C. dopamine, and D. both B and C. Right option is D. both B and C means inhibin and dopamine. Next question is, D cell of pancreas secretes A. insulin, B. glucagon, C. intestinal peptide, and D. somatostatin. Right option is D. somatostatin. Next question is, gallbladder contraction is stimulated by A. cholecystokinin, B. gastrin, C. vagus, and D. secretin. Right option is A. cholecystokinin. Next question is corpus luteum is maintained by A. progesterone, B. FSH, C. LH, and D. estrogen. Right option is C. LH. Next question is parathyroid hormone is responsible for all action except A. absorption of phosphorus increase, B. vitamin D absorption increases, C. mobilize calcium from bone, and D. increase in intestine absorption of calcium. Right option is A. absorption of phosphorus increases. Next question is under the control of hypothalamus all except A. increases heart rate with exercise, C. B. food intake, C. pituitary hormone regulation, and D. temperature regulation. Right option is A. increases heart rate with exercise. Next question is prostaglandin causing renal vasodilation. A. PGD2, B. PGF2, C. PGI2, and D. PGE2. Right option is D. PGE2. Next question is FSH acts on which of the following? A. glucose cells, B. theca interna, D. C. intermedium, and D. myometrium. Right option is A. granulosa cells. Next question is which of the following hormone is mainly responsible for skeleton maturation? A. testosterone, B. estrogen, C. growth hormone, D. testosterone estrogen ratio. Right option is B. estrogen. Next question is TRH stimulation testing is useful in diagnosis of disorder of following hormone: A. insulin, B. ACTH, C. growth hormone, and D. PTH. Right option is C. growth hormone. Next question is hormones secreted by adrenal medulla: A. glucagon, C. cortisol, C. norepinephrine, D. insulin. Right option is C. norepinephrine. Next question is the hormone associated with cold adaptation is A. growth hormone, B. thyroxine, C. insulin, and D. MSH. Right option is B. thyroxine. Next question is osteoclast has a specific receptor for parathyroid hormone: B. calcitonin, C. thyroxine, and D. vitamin D. Right option is B. calcitonin. Next question is insulin secretion is decreased by A. glucagon, B. glucose, C. adrenaline, D. acetylcholine. Right option is C. adrenaline. Next and last question is hormones secreted by adenohypophysis are A. oxytocin, B. gonadotropin, C. originin vasopressin, and D. thyroxine. Right option is B. gonadotropin. Thank you so much. Please like, share, and subscribe.